Good afternoon, everybody. All right, we'll give it just another minute to see if other people join us, and then we will jump back into our lecture. Yes, Ariel, just stick around on Zoom after class and we can chat then. Okie dokie. So we're just a little light on people today. Maybe other people will sign in a little later. But we'll go ahead and get started here. I just saw a couple of the people who signed on, so I want to make sure I mark that they're here. Because midterm progress reports are due this week, and I do have to say, like, how many times you've been here and all that good stuff. So, alrighty. So today we are going to continue our lecture on states of consciousness, and we're going to talk about drugs that change your consciousness, and pretty much anything that is a non-food substance can, and some food substances can. So this is kind of a fun one to talk about, although certainly if you know anyone in your family who struggled with substance use, this can be to hear about. So again, no judgment if that has happened. You certainly don't have to out anyone in your family. But just know that I have had people who it's difficult for them to hear about. But on the flip side, some people find it fascinating because they know of people who have struggled with this. So, and it might also be helpful to you to hear about it. I'm going to dive right in here to talking about these drugs of abuse. I'm going to go ahead and get my setup going here. You want to come say hi before I get started? You don't have to like slam into things. See, there's all the people. Oh, okay. I think it was my Theories of Personality class. I just taught with him in my arms one day because that's what he wanted. You know, you do what you have to do to keep the cats happy, clearly. All right, so I'm going to go ahead and screen share our PowerPoint here. All right. Get our chat up. In case anyone has questions or comments, they want to put it in the chat. All righty, so psychoactive drugs act on the nervous system. And so they can alter your consciousness, so they can put you in sort of a state where you're not quite aware of what's going on, right? Or you get pretty deep on some of these medications or drugs, rather. You can end up, blacking out, right? Which can be scary. They can modify your perceptions, or you think things are different than they are. You think the walls are talking to you or breathing, right? And they can change your mood. So why do people drink drugs? What do you guys think? Go ahead and take drugs, not just drink them. But why do people use drugs? What do you all think? Go ahead and put it in the to escape reality, stress. Yeah. To fill a void. Mm-hmm. Yeah. For pain. Yeah. So like especially the opioid crisis that's going on in America right now. A lot of that was pain management. You have to try to feel anything. Yep. Exactly what Michaela said. Doctors will give it to them, right? And then they end up addicted to it. And again, doctors aren't trying to get them addicted to it. And in fact, some of the lawsuits that are out now, part of what they're about is the fact that the drug companies misled doctors and told them, oh, these things, there's no way that they could be addictive. We clearly know is not the case, right? So yeah, certainly problematic there. And in terms of trends in adolescent use, so like high schoolers, it'd be interesting to look at it now. I wonder if it's altering because people aren't around their peers as much. But certainly, prior to quarantine, we had seen levels rising in high school age individuals. So in terms of effects on users, in addition to the direct physical effects that you can get from some of these substances, it can lead to people taking risks, right? Things like engaging in unsafe sexual behavior. You risk protection, you risk getting an STD or an STI, right? You risk pregnancy if that's something you're trying for. Health effects for some of these things, right? So if you have a heart condition and you're drinking a lot or you're using stimulants, it could certainly exacerbate it, right? There's also indirect health effects, right? So if you are spending so much time using a substance that you don't eat healthfully or you don't get a chance to go exercise, right? That can affect your health as well. It comes at school, work, and relationships. And in fact, this is part of the criteria for having a substance use disorder, is that it actually does affect your social life or your life at school or work, right? Not showing up, leading to conflict within your marriage or your family. And then psychological problems. So drugs can exacerbate existing psychological problems, or they can cause them. So, for example, some people, even after they've stopped taking drugs, they may have affected their brain so much that they develop depression because their brain can no longer create the same amount of neurotransmitters like serotonin. So then they might have to, go on like an SSRI for the rest of their life. And so this is actually pretty interesting. So the current version of the Diagnostic and Statistical Manual we use to diagnose mental disorders, or the DSM, doesn't differentiate between abuse and dependence. It's all just substance use disorders now. But it used to be there was like a substance abuse disorder and a substance dependence disorder. And I think it's still helpful to look at this distinction. So abuse is a behavioral pattern where you come to rely on the drug, essentially. So behavioral pattern where you rely on the drug excessively and regularly. Part of the criteria is that then that is going to cause damage in your relationships or your work or school functioning. Or it can even lead to you putting yourself or other people in danger, right? So imagine drunk drivers or people who drive under the influence of other substances, right? Not only are they putting themselves at danger, but anyone else on the road. And imagine they're a parent and they're driving with their kids in the backseat, right? So now there's another life that's in jeopardy because of it. Substance abuse is characterized by not meeting obligations. So maybe not showing up to work, not doing well caring for your family. Physical dangers like drunk driving. Legal problems can start to become an issue, right? Getting DUIs, DWIs, so they're not great, right? And unfortunately, some people, for the drugs that are illegal and difficult to get, will start stealing to get them, right? And persistent social or interpersonal problems like arguments with your family members. Substance dependence is what we typically think of when we think of addiction. So the term addiction, or like other terms like alcoholic, are not actually specific or diagnostic terms. They're more lay terminology. And so think about addiction, what we would call that now is just substance use disorder, but the physiological part of it is dependence on that substance. So you have all the criteria for abuse, but you also develop a physical dependence on the substance. So that's characterized by tolerance and withdrawal. Tolerance is where you need more of the substance to get the same effect. And then withdrawal is if you stop the drug, you get really unpleasant and sometimes even dangerous withdrawal symptoms. There are some drugs that you can die if you stop taking them cold. So like if you've ever heard of like methadone clinics, right? Those are to help people step down because if you just quit cold turkey, again, your body can shut down. And other bad things can happen with other substances with withdrawal. You can also have psychological dependence, where you're going to center your life around the drug and the experience. You spend essentially all your time getting the drug, taking the drug, recovering from taking the drug. And that your substance use will continue despite physical problems, psychological problems, relationship problems caused by the drug. So psychoactive drugs are chemicals that affect mental processes and behavior. Chemicals that affect mental processes and behavior. And they do that by affecting the nervous system in particular. So they're affecting thoughts, cognitions, mental processes, your behavior by affecting your nervous system directly. And so these are the 4 categories we're going to talk about. And you'll see that each has its own risks, essentially. And thing I always put is like my caveat to this is I'm not ever telling someone what they should or shouldn't do with their bodies. Clearly, I can't endorse doing anything illegal, right? That said, I try to be really clear about the substances I think you should never take because of their catastrophic consequences to your nervous system. So I'll try to be clear about that. All right, so depressants slow down your mental and physical activity. And they do that by inhibiting transition of nerve impulses. So they basically tell your neurons not to fire. Just take it easy, it's fine. People take these because they reduce tension, they can reduce your inhibitions, but it can also interfere with your judgment, sometimes your motor activity, sometimes concentration. And so the ones that we tend to think of as like sort of the horrible ones are barbiturates and benzodiazepines. Like some of what you all said in the chat, these are things that originally traditionally were prescribed for people and then became things that people misuse. So barbiturates in low doses, you use them as anti-anxiety medications. In higher doses, they essentially help you sleep. They're used for their calming effect. And these can be especially dangerous because there's a lethal dose. And that lethal dose doesn't change as your tolerance increases. So tolerance increases, you just get closer and closer to that lethal dose, right? And so then you're playing this game you might not even know that you're playing. Benzodiazepines like Valium, again, something that was prescribed quite a bit in the 50s and 60s. Valium was actually called Mother's Little Helper because they prescribed it to lots of stay-at-home moms who were just bored because they often had college degrees and weren't allowed to use them. And they're like, here, take this, you'll feel better. So it's a calming effect, but it almost sort of like zombifies you. And then the most commonly used depressant is alcohol. So a lot of people don't realize that, and a lot of people are when I say that alcohol is a depressant because they think like, but like hyper happy when I take alcohol. Yeah, that's because it initially depresses your inhibitions, but then as it works through, it sort of slows down everything in your system. And this is why some people are sleepy junks, right? And when they drink a lot of alcohol, they just Z out. Alcohol abuse costs society $148 billion annually. In a third of all suicides, homicides, sexual assaults, and regular assaults. And 41% of all fatal auto accidents, which is one of the top reasons for death in the US and I think worldwide as well, involve alcohol. So again, not something that I'm going to say never use this, and I'm sure those of us who are legal, right, only, have all partaken at some point. But certainly not something you should abuse, certainly not something you should like operate a motorized vehicle while you're under the influence of. Opiates, this is, again, the opioid crisis we keep hearing about, has to do with these. So these are also depressants, but they also have other properties. They are highly addictive. They produce a sense of well-being and strong pain-relieving properties. That's why they're prescribed as pain relievers. And again, as I mentioned, initially, drug companies weren't honest about, they were like, these aren't addictive at all, it'll be fine. And like memos are showing they did know they were addictive, but they lied to the doctors about it, so doctors prescribed them to everybody. Now we have lots of people addicted to them, and it's horrible what addiction to these does to you. So the original opiates are made from opium, which is the addictive substance made from the sap of an opium poppy. It does produce pain, but is highly addictive. There are two types of natural opioid derivatives that we commonly see. One is morphine. highly addictive, good at reducing pain. If anyone's ever had surgery and you have that like button you can press, right, to dispense pain medication, that's typically morphine. And then the other type that we commonly see is heroin. This is one of the most addictive substances derived from opium. It's illegal in the US, and because it's so addictive, because it's so deadly, within 2 to 3 weeks, its use can lead to abuse. And like your functioning just declines right away. And it comes pretty quickly after that. Users center their life around heroin. They build up tolerance. They experience really bad withdrawal if they don't receive the drug. So anxiety, restlessness, sweating, rapid breathing, twitching, aches, fever, vomiting, diarrhea, loss of appetite, high blood pressure, weight loss, all kinds of bad things. Basically, like if you're taking notes, just right, opioid withdrawal, awful, right? Not good. Opioids are also known as narcotics. So if you've ever sort of wondered why are like police divisions that focus on drugs called narcotics divisions, that's why. Someone overdoses on heroin, it can close off the respiratory center of the brain, and that paralyzes breathing and causes death. That's actually how people typically die from alcohol poisoning as well, is it essentially just slows down all parts of the brain until it slows down your brainstem. But typically you have to do like really stupid stuff with alcohol, right? 21 shots an hour when you turn 21. Bad, don't do it. Things along those lines. Also, what happens with heroin and other opioids is that dealers will mix it with other things. And so you don't know what it's being cut with. Sometimes substances are deadly in and of themselves, right? So that's really dangerous. Heroin is commonly injected just below the surface of the skin. So people who have unsterile equipment or share needles with other people run the risk of developing HIV or hepatitis or other bloodborne illnesses. It's been shown that as many as 60% of heroin users in some areas of the US have HIV. And this is why some cities now do needle switches, where they'll provide clean needles. And obviously this is very controversial because people think, well, you're fueling their drug habit. But people are sort of like, you know, they're gonna do it anyway, right? So why not? Heroin's one of the ones that I'd be like, don't ever take it. Don't ever try it. Not worth it. Messes you up way too much. Methadone is used for heroin withdrawal. So if you're trying to get off heroin, you've got to go on to methadone so you don't get those absolutely horrible withdrawals. The other one we haven't talked about yet is codeine. So if you've ever, like had a minor surgery, they might have given you Tylenol with codeine, right? Or if you had a really bad cold or bronchitis, they might have given you cough syrup with codeine. And it's like a low-grade morphine, essentially. Can get you pretty trippy, depending on sort of your own personal reactions. I'm going to mute real quick so you guys don't have to listen to the trumpet of my nose. Okay. So those are opioids. Obviously, huge problem in the US right now. Addiction to these. Stimulants stimulate or arouse the central nervous system. We're not talking about sexual arousal here. We're talking about arousal, speeding things up, slowing things, instead of slowing things down like depressants. So mental responses speed up, physical responses speed up. This results in increased blood pressure, an increased heart rate, increased alertness, quicker behavior, speeded up behavior, quicker thinking. Some other bad ones on this list, right? So cocaine. This is highly addictive and the most powerful natural stimulant known. It can cause, it's related to dangerous behaviors like violent crime, typically in pursuit of trying to get the drug. It's also linked to risky sexual behavior. Cocaine has many negative physical side effects. Cocaine overdose. So what happens in overdose is cocaine first causes the respiratory center of the brain to speed up, as it is a stimulant. But in excessive doses, it actually depresses it. And like the other types of effects here, it can actually, cause breathing to stop. Always bad. Ooh, I got a question in the comment here. How does Adderall work for ADHD? Really good question. So Adderall, other things like it, is a stimulant, which you might think, like, why would we give someone with ADHD who's already sort of like running around a stimulant? But what it does is it works on stimulating a very particular part of the brain, which is that prefrontal cortex we've talked about a lot. And one of the things the prefrontal cortex does is that it actually helps you organize, inhibit things you shouldn't do. So by stimulating the prefrontal cortex, you essentially suppress all of those things that you don't want to be doing when you're trying to actually focus if you have ADHD. So that's a really good question. Thanks for asking that. Because a lot of people are like, what do you mean we give people with ADHD stimulants? And that's why, because it works particularly on the part of the brain that helps to inhibit those behaviors and things like that. Let's see. Yes, caffeine is a stimulant. So we'll get to that in just a second. Other things that happen during cocaine overdose is the heart beats erratically and rapidly. And this is just when you're under the influence at all of cocaine. So it's forced to work harder to pump blood through the body. But because of its stimulant effects, what happens is your veins actually, so like if this is your normal vein, it's a vasoconstrictor, so your veins actually constrict, they get smaller. So now you're trying to pump more blood through tinier space in the veins, right? And arteries. And they're more likely to have a heart attack or some other heart problem or an aneurysm or something along those lines. So obviously big risks there. Amphetamines like methamphetamine, so meth, I know, huge issue in the US. Apparently I learned when I was on my residency that Charlotte, North Carolina is the meth capital of the South. Who knew? But it's everywhere, right? There are stimulants that are manufactured. So people kind of set up their own laboratories, which in and of itself is dangerous because if they don't know what they're doing, they can blow themselves up, right? And when you take them in small doses, they increase energy and alertness and reduce appetites. And because of that, in the past, athletes have used them as performance enhancers, not meth in particular, but amphetamines in general. And because they decrease appetite, they're one of the primary ingredients in diet pills. So if you've ever seen those ads that are like, more weight loss, faster weight loss, energy to burn, it's because you're basically taking speed when you take those diet pills, okay? So maybe not the healthiest thing to be putting in your body. When they're taken in large doses, they produce a rush, intoxication, and psychosis. So they start experiencing cognitive distortions, hallucinations. Tolerance builds up very quickly. So you can become dependent on it very quickly as well. So, for example, even if you aren't using like meth with this, right? Even if you're using like an amphetamine in a weight loss drug, because you build tolerance so quickly, then like you're not getting the weight loss effects. And so then you have to take more of the medication to try to get the same effect. And then you end up on so many diet pills if anyone's ever seen the old episode of Saved by the Bell, where Jesse's like, I'm so excited, I'm so scared, right? Same thing, bad, don't do it. When you stop taking an amphetamine, you plunge into a deep depression. Oftentimes you experience extended sleep. So it's very similar to the withdrawal symptoms from cocaine. MDMA, or ecstasy, or sometimes just called X, is a stimulant and a hallucinogenic. Um, it raises mood, gives you an energy boost. It's favored as a club drug for these reasons, but there are many, many dangers to it. You get confusion, depression, sleep problems, anxiety, paranoia, and these continue for weeks afterward, because essentially what ecstasy does is it makes your brain essentially dump all of your feel-good neurotransmitters all at once. And then it takes your brain actually weeks to recover and get back to where you normally are. So ecstasy is also on my, like, don't do this to your brain list of drugs. It can impair your memory, it can cause other cognitive dysfunctions. You can get physical symptoms like muscle tension, nausea, blurred vision, chills or sweating, grinding your teeth. Like cocaine and amphetamines, it can increase your blood pressure and your heart rate. You can't sweat as much for some reason when you take ecstasy. Well, that's one of the physiological problems. And so you can actually get heat stroke because of that. And so people will try to compensate by drinking a lot of water, but you can actually get what's called water intoxication as a result of not being able to sweat it out. And you can get liver damage pretty quickly with MDMA for that reason. Yes, caffeine is a stimulant. It is the most widely used stimulant in the world. People in the US alone consume 30 million pounds of caffeine annually. So it causes an increase in physiological arousal, increase in motor activity, reduces fatigue. It can also interfere with your sleep. So research, I think maybe 4 or 5 years ago, came out and said essentially, if you don't want caffeine to interfere with your sleep, you shouldn't drink it after noon. I know, like, most of you are probably like sipping on some coffee right now. This is just water for me, but you know, that's very atypical for anyone in the US, I think, to stop at that point. It increases your rate of breathing and gastric acid secretions in the stomach. This is why some people who drink a lot of coffee end up with ulcers. More than 2 or 3 cups of coffee at once, not spread out throughout the day, can produce what's called caffeine intoxication, which has restlessness, nervousness, anxiety, stomach disturbances, twitching, and increased heart rate. If you really go whole hog, I mean, you have to drink like 100 cups of coffee at once. You can get respiratory failure and grand mal seizures, but obviously that's something that's pretty rare to happen. And then nicotine, which is in cigarettes, right? Smoking has directly been tied to high blood pressure, coronary heart disease, lung disease, cancer, stroke. If you smoke while pregnant, it's related to birth defects. It's also been shown to be at least as addictive as heroin. So nicotine is at least as addictive as heroin. I always pause on that one because that boggles a lot of people's minds. So if you know someone in your life who's been trying to quit smoking for years and years and years and just can't, this is why. Because it's as addicting as heroin. So it's actually really hard to get yourself off of nicotine. When people go through withdrawal from nicotine, they experience irritability, increased appetite, sleep disturbance, their metabolism slows down, cognitive difficulties. So, you know, if you're sort of side using smoking as an appetite suppressant, right, a lot of people actually gain weight when they try to quit. So hallucinogens, again, quick pause here. So hallucinogens alter perceptions of the external environment as well as of inner awareness, so awareness of your own bodily function. So these are also called psychedelics. And they produce changes in sensory perceptions. So they may strengthen neural perceptions, or they may induce hallucinations and illusions. Some of these come from sort of natural sources. This is why I always kind of laugh when people are like, everything natural is good for you. It's like, really? Like hallucinogens, snake venom, right? Like not everything natural is actually great for you. But they can be synthetically made as well. So the big one that I think a lot of people think about when they think hallucinogens is LSD. And it can cause what's called hallucinosis, or basically hallucinogen intoxication. And that's marked by a strengthening of perceptions. And it causes psychological changes and physical symptoms, like illusions, where objects seem distorted, or they seem to like breathe or change shape. I remember when I was in high school science, we actually watched a video about drug use, and this guy talked about like going back to this museum he'd been to when he was on LSD, and he was like, this artifact I looked at just will never be the same vibrant shade of purple as it was when I was under the influence. So great that you had that experience, also kind of probably messing up your brain, right? And then the one that's probably used most commonly in the US today, and in fact is legal in several states, is cannabis or marijuana. So marijuana, hashish, CBD oil, right, is the new big thing. These drugs cause a mixture of hallucinogenic, depressant, and stimulant effects. So cannabis is kind of like, you get all in one. Tetrahydrocannabinol is the active ingredients, or THC. You may have heard it referred to as that before, THC. Would never expect you to know the long-term on a test. Basically, the greater the THC content, the more powerful the drug. So a lot of people, including one of my grad school professors, I remember we like argued with him for a while about this, think that like you can't abuse cannabis. You can't have like a marijuana use disorder. It's in the DSM. It is a thing. So what happens here is that you start using it regularly and it negatively affects work, school, or social functioning, right? You might not want to leave your room because you're just feeling pretty mellow. You can develop dependence on it as well, where your tolerance increases, and you might sort of get even more paranoid, afraid you're losing your mind. Marijuana has been implicated in many automobile accidents. It's been shown to cause a decrease in work, school, and social performance. If you smoke it, it can cause lung disease, just like anything else you smoke. And it also causes reproductive issues in any gender. So does this mean you should never use marijuana or it should be banned? No, I'm like leaving it up to the scientists who know more about this, right? That there's a reason it's being legalized in many states. But I think just like alcohol, which is legal, right? It should be carefully regulated, and you shouldn't be able to drive under the influence and things along these lines. So I think that we just need to kind of like take into account things like that. Just like alcohol, it slows down your reaction time, which means you're much more likely to get in an accident. I don't know how many of you either know Dr. Murlock Jackson or saw the news reports about her last semester, but she's a professor in our communication department, and she and her husband got rear-ended by a drunk driver. And they actually like thought she wasn't going to make it for a while. She did. She's teaching again. She's doing great. But, you know, people who drive under the influence of any substance, it can be really dangerous, again, not just for themselves, but for the other people on the road. So be responsible, especially in this era. Just call an Uber, right? Call a Lyft. Get a ride from a friend. Walk if you can. Be safe. All right, so when you do want to quit drugs, how do you do it? Well, there are a couple different things you can do. So 12-step programs are typically lay-led. So there's usually not a doctor involved. It's, you know, people who have been through the experience themselves. 12-step programs can be used in detox programs as well. They have group meetings, and then typically you get a sponsor. So someone who has more sobriety of the drug or alcohol than you do. And then you call them when you're feeling like using or you're just feeling overwhelmed for support. Particularly if you're on some of these drugs or like really have built up your tolerance, you probably need medical assistance to detox. So this is one of the things we did not treat in my training clinic when I was a graduate student, because we didn't have the medical facilities to do this well. So we would refer them to other places that did have that. So you might need medication, you might need to be just monitored as you go through it, right? There are also, in some cases, aversion medications you can take. So like for alcohol, there's something called Antabuse, where if you take it and you drink, you like immediately get violently ill. Sounds horrible. Why would anyone do that to themselves? It's sort of like a last resort if no other ways of quitting are working. It's like essentially using a behavioral technique to try to make this association that alcohol is immediately bad, so I'm not going to use it. You can do inpatient programs, and this is what they say when like, oh, people are going to go to rehab. They typically go to an inpatient program. Often those are for the people who are very severely addicted, need to be isolated from the world, need medical supervision as they detox. And you can do outpatient programs as well. And some of these might be sort of just a regular type of therapy, one-on-one, or maybe you do that as like once you're out. Or you can have what's called an intensive outpatient program where you essentially go to therapy all day and then you go home at night. Conditioning and cognitive interventions get people to alter the environments that they're in, reduce exposure to the drug, reduce the reinforcers related to the drug, help them be aware of the negative impacts that this drug has been having on their lives. And then there's a social psychological approach, which really focuses more on interpersonal and intrapersonal dynamics. So trying to help people increase their self-esteem and really emphasize how much this might be damaging your family. What is the impact of this on your family? And oftentimes that's a really big draw on people. This is why the show Intervention that works for people to kind of wake them up, because typically the family members are sharing like, this is what's happening to me as a result of what you're doing. Alrighty, so the next way we're going to talk about altered consciousness is by talking about hypnosis. So hypnosis is marked by altered attention and expectation and unusual receptiveness to suggestions. And most of you did really well on this question on the Explain It Wikipedia quiz. So kudos to y'all. So in hypnosis, you first want to minimize distractions. So typically you do this in like a dark, calming room, things like that. You tell them to concentrate on something specific. So maybe you have them count backwards or focus on a certain point on the wall. You know, the old sort of stereotypical one is like having them watch a pocket watch or something like that. When you're doing this therapeutically, you tell people what to expect. And then you sort of suggest things while they're under this open and relaxed state. Hypnotizability is actually an interpersonal difference variable, and there are individual variations in the ability to be hypnotized. And research actually shows that it is linked to a personality variable called openness to experience. So people who are more open to like new and novel ideas tend to be more hypnotizable. I actually am apparently high on hypnotizability. I had a grad school professor who did what he called cognitive hypnotherapy, where he would essentially use hypnosis to make people more open to changing their negative thoughts. And he didn't do that piece on me, but he used me a couple times for demonstrations in class to hypnotize me. So the first time he did it was actually really cool. Like all of a sudden my arm just started like floating up on its own. Even before he said anything about it, he's like, oh, your arm feels really light, doesn't it? And I'm like, yeah, what's happening, right? I remember everything that happened to me while I was hypnotized. That is typical when you do this therapeutically. Essentially, you don't not remember unless you're given the suggestion not to remember while you're hypnotized, if that makes sense. And typically, if you're doing it therapeutically, you're not going to do that. But if you've ever seen one of the like comedic hypnotists, right, who makes people like cluck like chickens, you'll notice that they'll like call people up and then they'll kind of like send some people away. They send away the people who aren't as hypnotizable, essentially. So hypnosis is an altered state of consciousness. And experts disagree about sort of why. Is it its own state of consciousness? Is it just suggestibility and you're more motivated to change during hypnosis? Is it just role playing, that it's sort of social desirability? This person wants you to be hypnotized, so you're hypnotized. Or is it like a dissociative state that you can get from things like trauma? So our professor that did hypnosis told us this really interesting story about hypnosis, that there was one guy who was like training to do hypnosis, and one of the ways you do that is you hypnotize the person. And for some reason, just one day it wasn't working, this person wasn't going to hypnosis. And so his trainer went out into his lobby, ripped the drapes off the wall and threw them around him like a cloak. And then the guy was able to be hypnotized. Just for some reason, like we see hypnotists as like magicians, right? With like their cloaks and whatnot. So it is sort of like, okay, what does that really mean? Is it social desirability? Is it, something behavioral? Not clear. But what we do know is as long as it's used well and safely and not nefariously, hypnosis can be very helpful. So some practical uses, researchers can use it. In particular, I think treatment is where it's the most helpful, including health psychologists will use it to treat health issues, such as substance use issues we've just been talking about. So smoking is a fairly common use for smoke cessation is a fairly common use for hypnosis. Our professor who did it mostly for reduction of pain. So for example, one of the people he worked with had TMJ, which is like a jaw pain disorder. And there are psychological stress elements to that. So essentially when you're using it to treat pain, you're using it to treat sort of the psychological portion of that pain, the stress related portion of that pain. And you essentially give the person permission to let go of that. So he was able to help this woman. Sometimes it's been used for mental and dental treatment as well. So you can kind of get a hypnotic analgesia where you have diminished sensitivity to pain while under hypnosis. I never learned it, but my grad advisor swore by hypnosis during birth. She said she used it to like sort of speed up time during the labor and delivery process. All right, probably the most common, not only in like the real world but in therapy right now, way to talk about changing consciousness is meditation, and particularly mindfulness meditation. So meditation is a form of consciousness change induced by focusing on a repetitive behavior. Often it has to do with assuming certain bodily positions, minimizing external stimulation. So if you've ever done yoga, that's actually a form of meditation, right? But you can do meditation where you sort of sit quietly and meditate. There are apps that help you meditate now, like the Calm app. Meditation is a peaceful state of mind, not occupied by worry. The idea is you're supposed to be in the moment. So many, what we sort of call third wave or newer types of psychological therapy, yes, it's good for the body and mind. That's a really good point, Laura. There's research showing meditation helps things like blood pressure, for example, reduction of blood pressure. Research shows that this really helps in terms of things like anxiety, depression. These modern therapies like dialectical behavioral therapy, acceptance and commitment therapy, there's like mindfulness-based therapy specifically for depression. They get people to focus on the moment rather than on, what has happened or what could be. And like I said, depression is a common thing. Anxiety, I would say, is probably the thing it's most commonly used for now. And chronic pain is another one. So I'm actually going to pull up a video real quick. Looks like my hyperlink is broken, so give me just a sec to find it, and we'll actually do a little meditation together. So this one's just a 3-minute one. It's mindful breathing, and you'll see just a little piece of what this is like. All right, so let me share my screen, make sure I have sound.
Mindful breathing. Close your eyes and rest your hands on your knees. Bring your attention to the touch of your body on your seat. Feel the weight of your body on your chair or cushion. Make sure that your back is straight and that you're comfortable. Take a few deep breaths. While you're breathing deeply, relax your shoulders, your stomach muscles, the muscles in your face, your hands, and your legs. Let go of all the tightness in your body. Now bring your attention back to your breath. Notice what it feels like as it enters through your nose, goes down through your throat, filling your lungs, and back out through your nose. Notice your stomach and chest rise and fall each time you breathe in and each time you breathe out. And just allow your breathing to be natural and relaxed. Now bring your attention to the feeling of your breath in your nose. Feel your breath as it comes in and goes out. Just focus on this sensation, paying attention to each time you breathe in and each time you breathe out. As you inhale, maybe your breath feels cool. And as you exhale, maybe it feels a little warmer. When your mind wanders, or if you become distracted, just notice what's going on in your head, and then gently bring your attention back to your breath, going in and out. Focus on the feeling of your breath and allow thoughts and feelings to come and go in the background. Now gently bring your attention back to the touch of your body on your seat and open your eyes.
All right, so reactions to that. You can write in the chat or you can unmute yourself. What was that experience like?
It was very calming.
Yeah, exactly. Relaxing, calming, people are saying in the chat. Yeah, and so this is why people encourage meditation. So it's calming. It helps you to sort of come into awareness of the moment. One of my favorite meditation exercises I've ever done is you imagine a stream And if you have a stray thought, you imagine like putting it on a little leaf and letting it float down the stream, which is really cool. So just sort of like, okay, I don't have to worry about that right now. I can let it go down the stream for now. All right, so even more relaxing, we're done with states of consciousness. So I am going to let everybody go early. So again, you can use this time to work on your Connect assignments or to just do whatever else you need. Maybe go meditate some more or take a nap if that really relaxed you. And I'll do my normal thing where I stick around in case anybody has questions. So I'll see you all on Wednesday.